Something's wrong with my memory. I often hear these words from my mature patients, from relatives who bring their grandparents, fathers, mothers to my clinic in the memory room and say, "Help, doctor, my dad has a problem with memory impairment. What to do, how to act, how to preserve his memory." Because after all, it's only for mature and elderly people to see a specialist. I beg you, watch this episode to the end, because at the end there will be real practical recommendations for you to be able, firstly, to diagnose your memory impairment, and secondly, which is very important, to take steps to keep your brain young and healthy. Memory impairment is one of the cognitive functions that suffers with age, and not only. When we talk about cognitive functions, we need to be very clear about what these brain functions are. The first is speech. Yes, it is through speech that we communicate with each other. We read letters, books, we write. We used to write letters to each other, but here's the thing. It appears that in recent years the world has been raising the alarm. The entire scientific community is discussing the issue, and there has been a massive discussion that we're moving away from the pen. From this ordinary pen, we've been writing less. We've moved our hands less. The letter writing genre is disappearing. We grab a computer or a phone or an iPad. We're typing text, printed text, but we've lost this very important aspect, written speech. A note for parents. Please, if you want your child to develop faster than their peers, let them watch less TV. You know the saying, those who read will rule over those who watch TV. Let them read books, write, and jot down something by hand. Fine motor skills are important. What's crucial is that at this moment, when a child writes, they are developing their brain. Well, it's the same for us adults. We develop our brains. It works in a completely different way. The next function is absolutely memory. It can be short-term, long-term memory. Yes, any of us sometimes notice, oh, I forgot to take something from work. Oh, what's in the kitchen? Why did I come there? Something I wanted to say now. I'm playing with words, of course. I do not forget what I want to say to you, dear viewers. But it's familiar, isn't it true? That is, memory disorders can be in young people, in middle-aged people, and not only in the elderly. Overall age is such a relative thing. The older I get, the fewer elderly people around me I see. Any of you could say that. When we discuss memory impairment, we should imagine that there are a lot of causes, and these are not only neurological diseases, brain infarction, traumatic brain injury, but meningitis, encephalitis, you will be surprised, but even common arterial hypertension, diabetes mellitus, endocrinological disorders, all these diseases can lead to memory disorders, to cognitive disorders. And others' emotions are very important. They're very subtle. It's not just about remembering or forgetting. One has to have a conversation to feel these nuances in speech, in a person's communication, to understand there is a social intelligence disorder or there isn't. Finally, it's the organization of the replication of a purposeful program of action. Despite the complexity of this term, I'll show you a little later how very easy and simple it is to identify these disorders. When we talk about cognitive functions, we should understand that there are several stages of development of problems associated with them. The first is subjective cognitive impairment. Imagine, you're a 30-year-old woman who is active, works hard, takes care of her family. You're running out of time and energy. You don't sleep well. You work a lot. You don't rest enough. Your memory deceives you. So you say, oh, I forgot to do this, this, and that. You go to see your doctor. He or she questions you carefully, finds out that you haven't had a stroke. Did you have a brain injury? You don't suffer from hypertension or diabetes. At the same time, during testing, you showed normal numbers and values. What exactly is that? Don't remember anything? I don't remember here, I remember here. That's fine, just call it no sign of willpower here. These are subjective cognitive disorders, the first stage. When a person experiencing cognitive disruption has no cause, but the tests show a normal value, it's a reason to pay attention to your behavior. Maybe something is, maybe I don't sleep well, I don't sleep enough, I don't get enough sleep. By the way, sleep, in which we spend a third of our life, is a very important element, a very important function. It's a paradox, but we don't pay attention to it, how we sleep. What's the quality of our sleep? Furthermore, maybe we are working too much and don't rest enough. Maybe we eat something wrong. Maybe we smoke or abuse alcohol. All of this is very important for... They ignore the fact that a person is already experiencing lasting memory disorders, they're irritable, losing interest in life, their social connections are narrowing. And this is certainly a reason to already reach out to a doctor. To find out the cause for the development of mild cognitive disorder syndrome is difficult. Unfortunately, relatives of patients often say, "It's all connected to her age, there's nothing to worry about." Yes, of course. With age, we probably do not become better. Our character changes. I can see that in myself too. But we cannot equate age, the numbers in your passport and cognitive disorders. The notion of old age can occur in a young person. I see these people with the eyes of a rotten pike perch. They look at this world completely indifferent. They are uninterested. They don't feel any emotions, neither positive nor negative. They've seen it all. They know it all. They're already 25 years old. And right next to them, there's an energetic, bright 70-year-old man with a perfectly clear mind. Interesting fact, British colleagues have conducted a study. It turned out that 30% of men who achieved a century-old and 15% of women of the same age do not have cognitive disorders at all, believe it or not. It's such a mystery. So what did these people do in their lives to better their brain function? My God, Dad, who's at the door? The toilet is going to close. Isn't that fascinating? This elderly patient seems to have all the symptoms of dementia, or in other words, severe neurocognitive disorder. Sadly, it's common for relatives of such patients to come to me and say, "Do something for my dad or mom. I've observed weird behaviors. They are drinking water from the toilet, and in the kitchen they are doing what they should be doing in the bathroom. Could you help us quickly? Can only throw my hands up in despair because there's nothing significant or promising you can do at the stage of dementia. It's necessary to have intervened much earlier. At the stage of moderate cognitive impairments, that's a crucial moment when we begin treatment for these patients, so they don't descend into the chasm of severe cognitive. With mild cognitive impairment, our mental clarity is preserved. We have the ability to elevate these functions much more. So what should we do? It's undoubtedly very important to see a doctor on time. You must be guessing that I'm going to talk about MRI again? No, that's the very last thing. It's an important method. But the doctor must initially have a talk with you to determine all the risk factors. I'll remind you of them over and over again because they are very important. High blood pressure, obesity, diabetes, endocrine diseases, low intellectual and physical activity, smoking. All these are factors that lead to cognitive disorders. Next, certainly, have there been any stroke or head injury? This is already neurological pathology. Major things that lead to pronounced cognitive disorders. Then comes the stage of clinical examination and neuropsychological testing. I got to say right away that not long ago, our American colleagues put together a test called SAGE, a self-administered hierocognitive exam. SAGE. By the way, it's a good abbreviation because aside from SAGE, it means wise person. American doctors came up with it so that they wouldn't have to make contact with the patient, but so that the patient could open up their computer, test themselves, and get an answer. By the way, it's available in Russian. You can see the link. Once we've figured out all the clinical characteristics, risk factors, tested the patient, done an MRI, well, you gotta have an MRI. We can start figuring out what to do next. We begin to understand what we need to do next. Of course, there are medications that can help to treat cognitive impairments, for restoring memory. They're definitely going to be relevant. They'll always be relevant. But I'd like to focus on what each of us, you and me, must do for ourselves with our family members, so that they don't develop cognitive impairment. At the recent World Congress of Neurology in Japan, I listened to my colleagues' report and hear the following. To prevent the development of cognitive impairment, it is necessary to maintain social contact, avoid depression or treat it without smoking, monitoring blood pressure, monitoring blood sugar, of course, rebuilding your brain after a stroke or cranial injuries. But it is very interesting. This is that we have to monitor the state of hearing function. The work of our European colleagues in 2019 shows that if a person's hearing decreases, then it is directly proportional to cognitive impairment. If you and I maintain physical activity, our mental activity, stay involved in life as much as possible, not necessarily at work, but make sure your brain works, trains, and this brain training would be constant, which helps to retain cognitive reserve. This is the key to success. Success in looking at this world with bright eyes, with joy for this world. Good luck to you. Watch our YouTube channel, click the bell icon so you don't miss anything important.